Welcome to our exploration of respiratory and renal physiology. These two systems are fundamental to maintaining the body's internal environment. The respiratory system ensures that oxygen enters the body and carbon dioxide is expelled, while the renal system, primarily the kidneys, filters blood, removes waste, and balances fluids and electrolytes. Throughout this video, we'll uncover how these systems work individually and together to keep us healthy. Let's begin by understanding why these systems are so vital for life and how they interact to maintain homeostasis. Respiratory system is responsible for the exchange of gases between the body and the environment. It includes the nose, pharynx, larynx, trachea, bronchi, and lungs. Air travels through these structures, reaching the alveoli where oxygen is absorbed into the blood and carbon dioxide is released. This process is essential for cellular respiration, which powers every cell in our body. Understanding the structure and function of the respiratory system is the first step in appreciating its role in physiology. Breathing is a mechanical process involving the diaphragm and intercostal muscles. When you inhale, the diaphragm contracts and moves downward, expanding the chest cavity and drawing air into the lungs. Exhalation is usually passive as the diaphragm relaxes and air is pushed out. This rhythmic process ensures a constant supply of oxygen and removal of carbon dioxide. The mechanics of breathing are finely tuned to meet the body's demands, especially during exercise or stress. Within the lungs, tiny air sacs called alveoli are the primary sites for gas exchange. Oxygen from inhaled air diffuses across the alveolar membrane into the blood, while carbon dioxide moves from the blood into the alveoli to be exhaled. This exchange is driven by differences in partial pressures of gases. The efficiency of this process is vital for maintaining proper oxygen and carbon dioxide levels in the body. Once oxygen enters the bloodstream, it binds to hemoglobin in red blood cells, allowing efficient transport to tissues throughout the body. Carbon dioxide, a waste product of metabolism, is carried back to the lungs in three forms: dissolved in plasma bound to hemoglobin or as bicarbonate ions. This transport system ensures that tissues receive enough oxygen and that carbon dioxide is efficiently removed. Breathing is regulated by the respiratory centers in the brainstem, which monitor levels of carbon dioxide, oxygen, and blood pH. When carbon dioxide levels rise, the brain signals the body to increase breathing rate, ensuring proper gas exchange. This automatic control allows us to adjust breathing during activities like exercise or sleep without conscious effort. Renal system, primarily composed of the kidneys, ureters, bladder, and urethra, is responsible for filtering blood, removing waste, and maintaining fluid and electrolyte balance. The kidneys play a central role in this system, ensuring that the body's internal environment remains stable. Let's explore how the kidneys accomplish these vital tasks. Each kidney contains about 1,000,000 tiny filtering units called nephrons. Blood enters the kidneys through the renal artery, is filtered in the nephrons, and leaves through the renal vein. The kidneys remove waste products, excess water, and electrolytes, forming urine. This process is essential for maintaining the body's chemical balance and preventing the buildup of harmful substances. Filtration begins in the glomerulus, a network of capillaries within each nephron. Blood pressure forces water and small molecules out of the blood and into the Bowman's capsule, while larger molecules and cells remain in the bloodstream. This filtrate then travels through the nephron, where essential substances are reabsorbed and waste is concentrated into urine. As the filtrate moves through the nephron, the body reabsorbs water, glucose, and essential ions back into the blood. At the same time, additional waste products and excess ions are secreted into the filtrate. This selective process ensures that the body retains what it needs and eliminates what it doesn't, maintaining homeostasis. After filtration, reabsorption, and secretion, the final urine is collected in the renal pelvis and transported to the bladder via the ureters. The bladder stores urine until it is excreted through the urethra. This process removes waste and excess substances from the body, playing a crucial role in maintaining internal balance. Kidneys regulate the volume and composition of body fluids by adjusting the amount of water and electrolytes reabsorbed or excreted. This balance is essential for normal cell function, nerve transmission, and muscle contraction. Disruptions in fluid or electrolyte balance can lead to serious health problems, highlighting the importance of renal physiology. Both the respiratory and renal systems work together to maintain the body's acid-base balance. The lungs regulate carbon dioxide, which affects blood pH, while the kidneys excrete hydrogen ions and reabsorb bicarbonate. This cooperation ensures that the body's pH remains within a narrow, healthy range, crucial for enzyme function and overall health. When the body experiences changes in pH, the respiratory system can quickly adjust breathing to help restore balance. For example, if blood becomes too acidic, breathing rate increases to expel more carbon dioxide, reducing acidity. This rapid response is known as respiratory compensation and is a key mechanism in maintaining acid-base homeostasis. Kidneys provide a slower but more powerful response to acid-base disturbances. By adjusting the excretion of hydrogen ions and reabsorption of bicarbonate, the kidneys can correct imbalances over hours or days. Renal compensation is essential for long-term regulation of the body's pH, complementing the faster respiratory adjustments. Oxygen delivery depends on both the respiratory and cardiovascular systems. The lungs oxygenate the blood, and the heart pumps it to tissues where it's needed. Adequate oxygen delivery is vital for cellular metabolism and energy production. Any disruption in this process can lead to tissue hypoxia and organ dysfunction. Carbon dioxide produced by cellular metabolism must be efficiently removed from the body. The respiratory system handles this by transporting CO2 from tissues to the lungs where it is exhaled. Proper removal of carbon dioxide is essential for maintaining acid-base balance and preventing respiratory acidosis. Kidneys are influenced by several hormones including antidiuretic hormone ADH, aldosterone and atrial natriuretic peptide. These hormones regulate water and sodium balance, blood pressure and urine concentration. Hormonal control allows the kidneys to respond to changes in the body's needs, ensuring stability. Renin-angiotensin system is a hormone system that helps regulate blood pressure and fluid balance. When blood pressure drops, the kidneys release renin, triggering a cascade that leads to the production of angiotensin II, which constricts blood vessels and stimulates aldosterone release. This system is crucial for maintaining stable blood pressure. Kidneys produce erythropoietin, a hormone that stimulates the production of red blood cells in the bone marrow. This is especially important when oxygen levels are low, as more red blood cells increase the blood's capacity to carry oxygen. This function links the renal and respiratory systems in supporting oxygen delivery. Antidiuretic hormone ADH is released by the pituitary gland and acts on the kidneys to conserve water. When the body is dehydrated, ADH levels rise, causing the kidneys to reabsorb more water and produce concentrated urine. This mechanism helps maintain proper hydration and blood pressure. Aldosterone, produced by the adrenal glands, acts on the kidneys to increase sodium reabsorption and potassium excretion. This hormone plays a key role in regulating blood volume, pressure, and electrolyte balance. Proper sodium balance is essential for nerve and muscle function. Respiratory and renal systems are closely integrated. For example, during exercise, increased carbon dioxide production leads to faster breathing and changes in kidney function to maintain acid-base balance. This teamwork ensures that the body can adapt to different conditions and maintain stability. Respiratory disorders such as asthma, chronic obstructive pulmonary disease (COPD), and pneumonia can impair gas exchange and oxygen delivery. These conditions may lead to symptoms like shortness of breath, fatigue, and in severe cases, respiratory failure. Early detection and management are crucial for maintaining health. Renal disorders such as chronic kidney disease, acute kidney injury, and kidney stones can disrupt fluid, electrolyte, and waste balance. Symptoms may include swelling, fatigue, and changes in urine output. Proper diagnosis and treatment are essential to prevent complications and maintain overall health. Acid-base disorders such as metabolic acidosis or respiratory alkalosis occur when the body's pH is disrupted. These conditions can result from respiratory or renal dysfunction and require careful evaluation and management to restore balance and prevent complications. To assess respiratory and renal function, healthcare providers use tests like blood gas analysis, spirometry, urinalysis, and blood tests for electrolytes and kidney function. These tests help diagnose disorders, monitor treatment, and guide clinical decisions for optimal patient care. Treatment for respiratory and renal disorders may include medications, lifestyle changes, oxygen therapy, dialysis, or even transplantation. The choice of therapy depends on the underlying cause and severity of the condition. Early intervention and ongoing management are key to improving outcomes. Maintaining respiratory and renal health involves regular exercise, a balanced diet, staying hydrated, avoiding smoking, and managing chronic conditions like diabetes and hypertension. Preventive care and healthy habits can reduce the risk of disease and support overall well-being. In summary, the respiratory and renal systems are essential for maintaining the body's internal environment. They work together to regulate oxygen, carbon dioxide, fluids, electrolytes, and acid-base balance. Understanding their physiology helps us appreciate the complexity and resilience of the human body. Thank you for joining this journey into the fascinating world of respiratory and renal physiology.